Hey y'all, Rayshawn here, and welcome to In the Wild. I am so excited for so many things happening this semester, and today we have another great episode in store for you because did you know that nursing is one of the most in-demand professions right now? So we have some really cool folks from the College of Nursing to talk to us a little bit about what students can experience if you choose to study nursing here, but also just some really cool folks. So first up, we have Dr. Shannon Broxton, who is really cool for so many reasons, probably quadruple reasons I could give you, because Dr. Broxton is going to soon be one of the quadruple Jaguars. So she has gotten her BSN, her master's, her DNP, her doctorate, as well as soon to be her PhD, all from the College of Nursing, which is so cool. So we had to talk to her about what about the university has kept her here, and she also teaches, so that's really cool. I can't wait to talk to her. And we have a friend of mine, Tanashia Thomas, who is also faculty over in the College of Nursing, and I can go on and on about all the cool things that Tanasia has done and been a part of. So I'm not going to hold you guys up, but we're going to talk to them because I just have a love for the College of Nursing, the nursing field in general, because once upon a time there was a little boy named Rayshawn who thought he was going to be a nurse. And as you can see, I'm doing this with y'all. I'm not a nurse, but we're going to talk to some who are. So here we go. Welcome, Dr. Broxton, on In the Wild. First time.
Thank you.
Very excited to have you here. And I want to say, out of all the cool things that you have going on in the College of Nursing, one of the most interesting things is that you're going to be probably our first quadruple JAG.
Yes, I'm very excited about that. We need to verify that. I want to verify that. I want that. I want a gold seal or
Right.
something that just certifies that I'm a quadruple JAG. But yes, I'm an alumni from BSN program 2003, MSN 2009, DNP or Doctor of Nursing Practice in 2015, and then hopefully I'll be graduating with my PhD next December in 2025.
So what does that feel like to be a quadruple JAG?
I honestly, it feels amazing, but I want to tell you about a little story.
Okay.
So I'm from Augusta. I've lived within 30 miles of where we're sitting right now all my life. And I can remember as a child riding near and around the campus, and particularly around where the old dental college used to be. And you would see the big sign that says MCG. And I remember being little and thinking, I want to be smart enough to go to the Medical College of Georgia. That's what I want to do. And even at that time, I didn't exactly know what, because I kind of thought I wanted to be a teacher, kind of thought I wanted to be a doctor. And then lo and behold, came upon nursing. And I don't know if I'll ever feel as much pride as I did when I got my first degree from MCG in nursing in '03. Every bit of it has been sweet, but just having that first I did it moment was like a landmark in time.
That's awesome. What initially drew you to, I guess, just the nursing field?
You know, there's a lot of literature out there that shows that people who want to care for people go primarily into two different fields, teaching or into nursing or medicine, you know, something in healthcare. And I thought I wanted to be a teacher because I liked interacting with people, I liked helping people, but then I was just completely enthralled with all things medicine, and particularly anesthesiology. I had a grandfather who was a chiropractor, and he had tons of books about anesthesiology, and I would play with them when I was little. I would pretend I was teaching, you know, people anesthesia. This is funny how it comes to fruition. And when I got to college, I was pre-med. This was originally, you know, when I came here, Augusta State, and I was pre-med, and I met some of my best friends in an anatomy course that I'd signed up for as an elective for my biology major. And in that course, I'd say probably 75% of them were pre-nursing.
Oh, wow.
And they were like, you don't want to do that. You don't want to go into medicine. You want to be a nurse. And I went home and I looked at things and I found out about nursing anesthesia. And at that moment in 1999, I knew I wanted to be a nurse anesthetist. And I kind of changed my major. And then honestly, you know, in speaking about the synergy between teaching and healthcare, I ended up being a teacher anyway because I went into practice and then ended up teaching. And the teaching part was just as equally as fulfilling to me as doing the patient care. So I'm very lucky in my role now that I have to be able to kind of check both of those professional and personal boxes for myself.
Yeah, I was just gonna say you're kind of able to merge both of your passions into one thing.
Yeah, yeah. I mean, and honestly, for folks that are in healthcare, there's an element of teaching in that too, because you're teaching your patient population. So if there's somebody that has a new diagnosis, or like for myself, when I go and meet a patient in the morning before I'm going to perform an anesthetic, I get to teach them about what I'm going to do so that they're well informed and making sure that they're consenting to something that they want to do. And I teach them about how things are going to feel and what it'll feel like afterwards. And then that completely transfers over into the classroom when I'm teaching in depth, you know, all the things that you need to know about anesthesia to actually perform it.
That's really cool. And what motivated you to, I guess, continue to come back to AU?
Oh man, you know, it's probably that underlying respect and privilege that I thought was associated with going to MCG, honestly. You know, we, as Augusta University, we are MCG. We're a lot of things that, you know, we're our entire history. Mm-hmm. So when I say MCG, I know that now we're talking about the Medical College of Georgia as part of Augusta University, but for a kid that grew up here in Augusta, what is Augusta University now was the Medical College of Georgia. So, and that's what my first 2 degrees actually say, is MCG. So having that prestige and knowing how talented you were if you came out of MCG or now Augusta University, that's what's continued to bring me back. I really believe in our quality. I believe in our product. I put my stamp on all the students that come through my program. So I feel like there's no better way to show how honest and transparent I am about my feelings about the university than to being a product of it myself. So, I mean, obviously, there are a lot of options, you know, for somebody like me to go to other places to get my degree, but I believe in what we do. And I think, you know, to some people, if we're being honest, some people say, wow, you got all your degrees in one place. You know, you should have gotten out of that system and figured out some other things. But for me, I feel like I've taken advantage of all different types of services that the university offers. It's not just one thing. It's just not one person or one faculty member. It's lots of different services. And then part of my success, obviously, and all the things that I've done is because I'm a product of Augusta University.
I love that. And for me, because I'm not from Augusta, but I do credit this university to transforming my life, because I came here undergrad and I just loved being a student, everything about being a student. I was sad to leave, and then now I'm back.
You stay, yeah. They come back. We come back.
So I can definitely relate to the experience that you had a little bit. But since you've been or have a long history with the university, I'm curious about any other memorable moments that you had as a student or as a faculty that you like to share.
I have a lot. Let's do it in phases by degrees. Okay. So, you know, I mentioned that I was at Augusta State, which is the Summerville campus, and I was doing all my prereqs to get into the nursing program for my BSN. And one of the most memorable moments I have is with a class that was taught in, I believe, government. I think it was U.S. government. And it was an 8 a.m. class, and I'm very excited. It's my first semester, and I come in, and I have a bag full of books, because back then, before your time, we had books. But we had a bag full of books, and I sit down, I'm ready, I'm eager, and we're waiting. And it's about 10 minutes into the class, and there's nobody in there, no professor. There's probably 30 to 40 people in the classroom, and they're all just chattering. Where is this guy? I can't believe this guy's not here. We're wasting our time. And I'm just sitting there being quiet and just being like, yeah, at what point do we get up and leave, you know? And lo and behold, somebody from the middle of the room just gets up out of one of the desks and goes and stands at the front of the classroom and opens up a briefcase, gets some things out, and just like, okay, everybody, good morning, I'm Dr. Ray Whiting. I'm going to be your professor for this course. And everybody dead silent, just aghast. I was embarrassed secondhand from everything that they had said in his presence and they didn't know. That was a very good lesson for me though. It was a very good lesson. I realized at that point to always know who's in the room before you make any statements. He definitely didn't take it out on anybody, but that was very memorable. That was a very, very memorable undergrad experience. I could never do that today because of web pages, and I meet my students at orientation, so I can't sit in the middle of the class and then get up and pretend like I was never there. It's not going to happen. But that was classic, and I remember it like 26 years later.
I definitely would have been experiencing the secondhand embarrassment because I'm usually like in classrooms, like I'm probably more quiet than I usually am. But yeah, I'd have been terrified.
I'm not introverted, but back then, I was just out of high school, just, kind of figuring out college, literally first week, and I was not going to make a sound. And I think that served me well. He still smiles at me when I see him around
I was going to say, does he remember that?
I've never brought it up to him, so I guess we're going to see how he likes it.
Yeah, now that he's watching this.
Yeah, I'm going to make sure I send him a link.
Okay.
And I'll be like, hey, do you remember this? Did you do this to everybody? Yeah.
I love that. But switching gears a little bit, what is it like to be a nurse and just kind of being in practice? Because I feel like there's a lot of people who still come here for the College of Nursing and they haven't had any experiences in high school or as their time here on campus with patient care. So I'm curious.
I didn't have any access to patient care per se when I decided that's what I wanted to do. I think sometimes I think I have to believe that sometimes you just know the things that you might be good at and know the things that you're interested in without actually practicing at them. Now we have better opportunities for students who think that they might be interested in something through shadowing. So that's different. Back in my day, there wasn't a shadowing opportunity for nursing. You just kind of had to think, is this what you want to do? And you went for it, and it's paid off in dividends for me. I'd say that if pressed and I had to say what I like better, teaching or caring for patients, I'd have to say caring for patients. That's just who I am at my core. I do also love very much the value that I bring in the gifts and talents that I'm allowed to share or able to share with my students. So they both give me so much joy, but it'd probably be a 51-49 split if I'm really thinking about it, because to me there's no greater service than providing for your community and making sure that their healthcare needs are met. And I think from a university standpoint, that's our goal, from the health sciences perspective, is we want to be a part of making our community in the world a better place because of the providers that we're creating.
Do you think your experiences with being an alum kind of influence your teaching methods?
Yeah, I think so, because my students would probably tell you that I am Team Augusta. So sometimes, I'll give you an example. My program, just for the record, is a nursing anesthesia program. It was the first doctoral nursing anesthesia program in Georgia, the first program in Georgia, the oldest program in Georgia, the largest program in Georgia. So there's a lot of pride that I have in being an alumni from that, and that absolutely is transfused into everything that I do, because I'm constantly building us up and talking about our statistics and the things that make us so great and our amazing faculty that we have in my program and in the college and in the university. And anytime somebody brings up another college that is a competitor, I'm like, we don't say that word.
Right.
We're Augusta. So my job and my role that I have now as program director of the nursing anesthesia program is to not only lean on all of those firsts and achievements that we have, but to continually strive to be bigger and better for our state and for our country.
I love that. And what would you say are some common misconceptions about the nursing field that you kind of want to myth bust for students?
You know, I don't know that there. Every good and bad thing you hear is probably true. I will say, if you're trying to get a good impression of what a nurse is off of Grey's Anatomy, it's probably not the best. But there are certainly Grey's Anatomy moments when we're taking care of patients. Myth busting, I'd say, don't come into nursing if you think it's easy. It's not easy. There's a price you pay. You're paying your tuition, you're paying your hours to learn a skill, and then there's a part of you that lives with every patient you take care of. You might not remember all of their names. You'll definitely, just like I remembered the situation with Dr. Whiting, you're going to remember certain patients in their highest moments and their lowest moments. But to me, that's beautiful. That's what my contribution is. That's me being a productive member of society and taking care of, the good of everyone.
Absolutely. Do you feel like because you work where you went to school, like you're kind of paying it forward a little bit with your teaching experiences?
Yeah, absolutely. It's funny because, like I said, when I was a child, I thought I wanted to be a teacher, and that switched, when I became got into the double digits. But one of the funniest things happened to me. My program director, when I was in nursing anesthesia school, he retired not too long ago, and he shared with me a piece of paper that he used to rate me during my interview into the program.
Oh, wow.
So that would have been in 2006. So in 2006, I interviewed for the nursing anesthesia program, and I was accepted to the class that started in 07. And on that paper, there's a handwritten note that says, "Wants to teach anesthesia in the future." And I have it in my office now because it's the coolest thing to me. I don't even recall saying that, but I have always wanted to teach, and it is something that I've been excited about doing. And the alumni part, again, comes from pride. I feel a lot of pride as being a graduate and an alumni, a triple alumni at this point from Augusta University, and that's something that I like sharing with people. I like telling them about it. I like using it as an advertisement. When I go speak at conferences, I kind of make a joke about it, and I'm like, I'll name each degree I got and then separately name Augusta University each time, or sometimes I'll, say MCG, Augusta University, all the same place. And but it's a song that I like to sing. I mean, I'm excited that I'm a part of Augusta University. I'm excited that I'll ultimately be a part of the history forever in the role that I've played.
Well, since I'll be new to teaching this fall, do you have any advice for any folks who will be stepping into that type of role?
Oh, yes. So, I like to pride myself on looking young in the face, considering how old I actually am. And one of the things that I want to advise you about is your students are going to want to be your friend. And that's hard. There, you got to draw a line. You can be compassionate and nice to them, collegial, but be careful about engaging in friend activities and kind of crossing that line, because students will cross that line and want to see you as a peer instead of kind of having that position that you need to have as an educator to a student. Number two, this one's probably really important: imposter syndrome. It's real. I feel really knowledgeable about my field, and the moment I stood in front of a group of students to talk to them about something I knew very well, immediately I started doubting myself. I'm like, can I do this? Do I know what I'm doing well enough to teach it to somebody else? And are they going to respect me because I'm kind of young in this, as far as a professor goes? And, have I had enough hours in doing this practice to consider myself an expert? Got to push all that stuff aside. And the other thing is, sometimes, within your own department, you look at yourself and you start comparing yourself to other faculty that are your colleagues, and you're like, man, that person's a fellow, or that person has done this and that person has done that. And just remember where you are in your own professional career and what you want to get to, and align yourself in a trajectory with those goals, not anybody else's, just yours.
I appreciate that. I'm going to watch this back so I can make sure I have all of those written down and just like put them on my walls for my
I'll be
teaching
your
journey.
mentor. We can have coffee.
I love it. I love it. But going back to campus stuff, when you were a student, what would you say was like your favorite spot on campus?
I had two favorite spots because I've been on both campuses. So on the Summerville campus, when it was Augusta State University, we used to have a kind of a cafe sort of situation right outside the Arsenal Oak.
Oh.
And it was very shady because it was a huge oak tree and it was beautiful and it was a showpiece of the campus. And ultimately, I believe it was struck by lightning and, now it's turned into some, memorable pieces. But that was a cool area. Now, I'm very excited for the students. They have the amphitheater, they have different pavilions, they have all this green space. It wasn't quite like that when I was here on the campus, but what we had was wonderful. And I will say the science building that's here, the last year I was here was the first year that we got to have classes in what was then the new science building. So that was...
And now we have a
newer science building on the other campus. But those were the places I hung out. I didn't do a lot of studying in the Reese Library. I'm not really sure why, because that changed when I went to the Health Sciences campus. I did a lot of studying downtown in the Metro Coffee House.
Okay.
When I was in
Shout
undergrad. Shout out to Metro. But when I moved into the BSN portion of my undergrad, I spent hours in the Greenblatt Library. In fact, I don't know if this exists anymore, but prior to any renovations, there were little office cubicles that you could rent on the perimeter. Oh, yeah. And I had my own little study carrel. That's what it was called. I had my own little study carrel with a lock and key, and it was set up, and it was like my own little desk. And I spent hours in there a day, most days, studying. And I did the same thing when I got my MSN. I rented a study carrel, and I have always treated since high school, not during high school, but since high school, I've treated academics like it's a job. So I come in and I plan to be there on, from like a 9 to 5, 8 to 4. And if I'm not in class or I'm not taking a lunch break, I'm studying.
Yeah, I was going to ask, like, how do you manage your time, especially 4 times over at this point to like power through? Because me trying to get my master's degree, I'm like, oh my gosh, I'm not going to make it. And crying to all my friends and everybody else that would listen, like, oh my gosh, I'm not going to make it trying to work full time and do a master's degree. But yeah, I'm curious how you were able to.
So I'll have to, I'd be remiss if I didn't use this opportunity to kind of mention how much I changed from high school to college, because I feel like maybe somebody will hear it and it'll inspire them. I was a terrible, terrible, terrible high school student. In fact, I was supposed to graduate high school in 1996, and I graduated 2 years late. I was almost 20 years old when I graduated from high school. And that's because I was not a good student. I did not prioritize my education. I prioritized my friends. But I kept at it. And, at one point when I was 18, the guidance counselor at my high school was like, you need to just quit. She sat me down, and she was like, you need to just quit school. School's not for you. You need to get your GED, you need to get a job. And I went home and I took the weekend to think about it. And that was a pivotal moment for me. Everything changed. I was very upset that I had gotten to a point where, knowing that I was intelligent, that I just wasn't committing myself to something that was going to make my life go in the direction I wanted it to go. So I went back to school that next day. And at the moment that I changed my study habits, my GPA was a 1.8. Every class for 2 years that I took after that was a 4.0.
Oh, wow.
And pretty much that's been the song and dance since. But I realized at that moment that if I wanted to do something, and that nobody could tell me that I couldn't do it. So it's a little bit of being a Taurus. But
I'm also a Taurus.
Are you? Nobody could tell me that I couldn't do it when I knew that I could do it. So that's one piece. So I used to do I wouldn't call it counseling work, that's the wrong word, but mentorship for high school students that were kind of troubled and thinking that all was lost and, they were never going to have the life that they, thought they could have, to show them that you absolutely can change it around. But second to that, everybody has a certain level of anxiety. And there's a healthy amount of anxiety that you have. And I'm the kind of person that I have a healthy level of anxiety if I have something on my plate. And the closer I get to a due date, the more I dig in and I'm hyper focused. So when I'm writing papers, if I know that I have a paper that's due in 4 weeks, I can't start writing it until maybe under 2 weeks, because something in me is just not going to make me focus. But when I focus, I can't be distracted. I can just hammer it out. And that's just kind of how I tackle things. That's my mode that I get in when I work. And it honestly kind of trickles over into the OR a little bit, because when you're in the OR, imagine being at the head of the bed and you're in charge of someone, while they're in the most vulnerable state that they can possibly be in, having surgery. And I am hyper focused on that person. Every breath they take, every heartbeat. And then when the case is over, we can relax. But during the case, hyper focused. And that's kind of how I've tackled all the degrees, all the assignments, all the tasks, is just having that diligence of being able to just do it and just know I'm going to do it. I want to check it off my list.
Before I let you go, do you have any other words of encouragement for those who are thinking about going back to school or are back in school for another degree and they're trying to power through it?
Yeah, times are hard. Things are expensive. Your time is expensive. My first degree, I wasn't married. I didn't have a family, and it still seemed kind of hard. But I think it's because you're a young adult and you don't really know what hard is yet. And then during my master's degree, I had a family. I had, a child I was looking after. I had, the other things going on. And you have to get to a point in that stage of your life when you're trying to pursue graduate level work or even maybe a late in life first degree attempt, that you have to set time aside for you, and that you're doing this for you, but it's also going to trickle down to every other aspect of your life. And if it's something that's going to benefit you and your personal growth, then it's going to benefit your family. So when you're missing small events right now, I can remember the first time I had to miss a Halloween party or a birthday party. You're missing those things right now. They're small sacrifices that are going to get you to the place you really want to be. And also, just picture your goal as an elephant, and you cannot eat the elephant all in one day. You just take a bite. So every semester, every credit you take, every time you turn in an assignment, it's just another bite of that elephant, and eventually it's gone, and you're there with your prize.
I love that. Thank you for being here, talking to me. We're going to stay in touch with all of my new roles as becoming a professor.
Absolutely.
But yeah, I really enjoyed chatting with you.
Thank you. Thank you for having me. This was fun.
And y'all stay tuned because we'll be right back.
Hello, my name is Yamil Santana, and I'm a counselor here at Augusta University. I wanted to take a moment to talk to you about student counseling and psychological services, also known as SCAPS. Our mission as SCAPS is to provide free and confidential mental health services for currently enrolled Augusta University students in a safe and inclusive environment. Our goal is to promote and preserve student wellness. We pursue our mission by delivering direct clinical care to students. In addition to brief therapy for individuals, group counseling, and crisis services, we also offer consultation, prevention, and outreach presentations. We also pride ourselves in our graduate level training program, which prepares future mental health professionals and supports Augusta University's academic mission. We provide all of these services through the highest standards of practice, as guided by our professional and ethical codes of conduct. We help students better understand themselves, others, and the world around them, so that they can make intentional and informed choices that facilitate wellness. You may be wondering, what are some of the concerns that bring students to SCAPS? Truth is, we see students for an extensive variety of concerns, such as anxiety, depression, suicidal thoughts, and loneliness, among many other concerns. If you're wondering if your concerns are valid or if they could be addressed by working with a mental health professional, then please consider giving us a call. Contacting SCAPS is a great first step in moving in a helpful direction. If we believe we're not the resource for you, we'll make sure to point you in the right direction. We encourage you to make taking care of your mental health a priority during your journey here at Augusta University. And we invite you to let us support you along the way. Thank you, and may you be well.
Tanashia, welcome to the show. I'm so excited to have you.
I'm excited to be here.
Yes, we've been so excited. We've been talking about it for a while, so I'm glad to have you on the wild. So welcome, welcome, welcome. So for our listeners, could you introduce yourself and tell us a little bit about your role with the College of Nursing?
Yes, so I'm Tanashia Thomas. I've been a nurse for 6 years now. I've been working at the College of Nursing for about 3.5, 4 years now. I graduated from Augusta University as a nursing student, and I'm currently in the DNP program at Augusta University for a concentration in acute care. And I'm a nurse at Augusta University, so I feel like I'm in all kind of different aspects of the college. But I am very happy, very grateful for my experience, very grateful to be where I am in my career, and I just keep going, so I'm just excited.
Yeah, so we're so excited to have you here on the show because we've been talking about just the nursing field earlier with Dr. Broxton, because she was an alum, you're an alum as well, and I guess as we get started, I was curious to learn a little bit about how you came to AU because you're a transfer student as well.
Correct.
So yeah, tell us a little bit about that.
I originally went to Georgia Southern University. I loved it there, and I've always thought about moving to Augusta after college, just because of all the hospitals here, multiple hospitals here. So
Right.
I was like, that's where I want to go. I was like, I don't really want the hustle and bustle of Atlanta, but I want a little bit something more than Statesboro. So I knew I wanted to be in Augusta eventually, and it just so happened that I got accepted into the nursing school here, and I was like, well, why not come a little earlier? So I came, and it was definitely a change because Georgia Southern is such a close-knit campus, and AU is a commute campus. So that was different for me, but the nursing school or the health science campus was being built up, and I know the college had merged with MCG, so everything was very, very new. And so just to have that experience of the health science campus being so concentrated, I think really made an impact on me, my experience in the nursing school. So, but I loved also that I could come to Somerville and still have a college experience with different things. So it was a great mix, very easy.
How did you know that nursing was the right field for you? What made you want to study nursing? And then we'll get, I guess, more into the realities of it. But I guess, how did that get started for you?
I knew I wanted to. So when I was in high school, I was kind of searching for what is it that I like. So I knew I liked math. I knew I liked science. I knew I loved helping people. Helping people made me happy. So I was like, well, how can I combine all three? So originally I was like, maybe I wanted to be a physician, like the doctor or a physician assistant, but they're always on call. And that from my knowledge, they're always on call. And when I was researching, I was like, I don't want to do that. I don't want to be called in the middle of the night for anything. So I was like, okay, well, what else can I do? And so I found nursing. And I was like, oh, well, I can do that. But I knew from high school that I didn't want to just stop to be a nurse. I wanted to go further to be a nurse practitioner. And unbeknownst to me, nurse practitioners can be on call too. But I was like, well, because I can't escape it. But that's how I wanted to be a nurse. And so starting out at Georgia Southern, I was graduated from Statesboro High School. So it was kind of just an easy transition from home. And I knew they had a great nursing program as well. So that's kind of how I got started in it. And I just chose it because of my interest, really.
Going back to just your time at AU, what would you say are some of your favorite campus memories from being a student here?
Oh, one of my favorite campus memories has to be crossing Delta Sigma Theta with my chapter Musi. It was an amazing experience to experience Greek life, especially with being on Health Science campus. You're separated from a few things on Somerville campus and having a college experience, so to speak. But that's one of my favorite memories was crossing into Delta. Another memory I really loved was being a part of my cohort's class. I was the class philanthropist for my nursing school, for my nursing class. So got to be a part of meetings, got to be a part of just helping my class, be involved in different activities with the city, with the campus, and different things like that. So really enjoyed that. And just doing things outside of nursing. I try to like have, even now with being in school, I try my best to have a life. You know, you have to have some type of release of stress. So getting involved with different things, getting a hobby,
Right.
those types of things really helps. So
Yeah, and working and being in school is a challenge.
Oh my gosh.
Well, for those watching, you may not know this, but Tanashia and I also go like way back.
Yes.
And so like I don't remember when we actually first met, but I do remember when we were working on the step show together.
Yes.
And that was probably one of my favorite campus memories with you because we came in second place.
We did.
For homecoming. That was so fun to be, and I even remember then like
We
when we were
did.
doing like practices and stuff. It was like you had classes and you had other stuff going on.
Oh my
so
gosh.
you know, be there with us, but it worked out.
It worked out.
That was a fun time.
I probably like the first time we all got together, like at Ashley practice was at the show. I feel like because I was like I never had time, but no, oh my gosh, we did. That was so fun.
And how do you balance, I guess, just like all the different priorities and things that you have going on? Like, what does like that work-life balance look like for you? Like, what helps you?
Ooh, I think what helps me the most really is having a calendar. Like I have a color-coded calendar in my phone that tells me when I'm doing things, when I have like what things I'm doing, whether it's working, whether it's helping with a podcast or or any other activities, going home to visit my parents. So I just always prioritize and make sure that I'm spending time with friends. Spending time with friends really helps my mental health. Like truly just to release and talk and chat. Like I can sit with a friend and talk for like 3 hours. Like truly just to talk. And it really does help. Not even just to talk about work because you're always at work or you're always doing school, but to talk about like what are you looking towards? What are you looking forward to? I love to travel. So planning a trip, that's also part of my like release of stress and mental health. Love planning a trip. Love spending time with friends and family. So making time for that as well is really important to me because you can't always be on go. Like you will burn out. And I learned that the hard way. So you will burn out. So you have to make sure you prioritize things that make you happy, whether it's a hobby, whether it's visiting friends or family, or going to a new restaurant, exploring the city. So I definitely think prioritizing, making time for yourself is what helps me, truly.
So I guess leaning into the more, like the realities of the nursing field, because I feel like it's changed in the past couple years, especially with the pandemic. Like things have kind of shifted a little bit. Like a lot of folks who are interested in nursing are, becoming travel nurses. Mm-hmm. Did you have any experience with travel nursing?
I did. After actually about a year or so into me becoming a nurse, it wasn't a pandemic yet. It was about 2019. Mm-hmm. So I really wanted to travel nurse, and I knew that was one of the things I wanted to try before going back into school because I didn't think I would be able to travel nurse while I was in school. So I went to Tennessee. And it was by far the worst travel assignment I ever had. I was not great at all. So when I came back, it was a great experience. I loved the experience. I really think it opened my eyes to a lot of things, including driving in the snow because it was in the winter when I was in Tennessee. So whenever I came back, I actually came back full time back to work because I was like, I'm just gonna give travel a break. But then I went back into travel nursing, and I went to different places, to Greenville, to Indianapolis. Indianapolis was one of my favorites, and I loved it. I loved it, and I applied for school while I was travel nursing and found out I got in, and then I was like, well, I got to give it a rest. So I did travel into school a little bit, like the first year, because the DNP program is actually, first 2 years are online.
Oh, cool.
So I still was able to travel for like the first year. But after that, I kind of settled down because we were getting ready to start clinicals and whatnot after the second year. So I came back to AU Hospital and started back PRN there.
So what has it been like to not only have patients, but also to have students?
Oh, honestly, in a way, I treat them the same, because with patients, you're educating them, right? You're educating them on medications, their diagnosis, educating them on why they're here. Especially with being in oncology, you're always educating patients because it's a whirlwind of like emotions, a whirlwind of medications, diagnosis. So with students, also teaching them about the diagnosis, the treatment plans that we do for different diagnoses of cancer. So in a way, like education is like that piece that I feel like bridges patients and teaching students. And I think that's a big component of nursing in general. So, and advocating. You advocate for patients. You advocate for your students. Like,
Right.
if they need help with anything, especially with the College of Nursing, I might not be able to help you, but I know somebody who can. So, that type of thing. And then with, of course, same thing with patients. You're advocating on behalf of them to the physicians, to different resources that they might need. So,
Did you have any mentors or folks that you looked up to throughout your process into wanting to even consider teaching?
yes, actually, two people that come to my mind is Dr. Lisa Prince Clark and Dr. Robillard, and they truly made my experience in nursing school. They're wonderful, wonderful teachers. Lisa Prince Clark actually wrote my recommendation to DNP school.
Aw.
And I mean, she always follows up with me to make sure I'm okay. How you doing? How's the dissertation going? How's the research? But so just to have that type of support, that continuous support from you being a nursing student to you being a DNP student is just amazing. So, and Dr. Robillard always I try to emulate my teaching to her because she made learning so fun. She made it funny, enjoyable. She let us know different real life scenarios. And that's really what I try to do as well with teaching, because you're there, you know that you have to learn these things, but you also want to have fun with it. How can you remember, all these things? There's so much information with nursing. So I try to make it enjoyable as much as possible. And so those are two people I really looked up to when I was in nursing school.
I'm glad you had those experiences because they definitely make a difference. Like having the right professors and having just the support from them definitely does make you want to kind of give back in a way and like kind of pay it forward,
Right.
in a sense. But I'm also curious, just in nursing school, like what are some of the challenges that you see your students facing, or things that you may want to, I guess, make future nursing students aware of? Like, hey, this is kind of like what it looks like to be in nursing school.
So I think something that I realized they're going through, well, first of all, life. Life doesn't stop.
Life be lifing.
Life be lifing. So life does not stop when you're in nursing school. There have been students who've lost parents. There's been students who didn't get the grade they wanted, and they're far from home, especially with seeing those students, like they have to travel. So I feel like life always happens, but the biggest thing is to make sure you communicate. I think that's something I learned as a DNP student, and that I see my students going through too. Because you have this, especially as a first year nursing student, you're all about the nursing school. You're all about learning to be a nurse, not realizing that life continues but in the background, So it's hard to like come out of that nursing mind, that nursing student mind, to like enjoy yourself, first of all. take time for your mental health. You get really, really stressed out with nursing school. I honestly joke sometimes and say, I wouldn't wish nursing school on my worst enemy. Like, I really wouldn't. It is a very stressful environment. It can be. But you have to make decisions to take time for yourself. That, I feel like that's the most important thing. When I was in nursing school, I told myself I am allowing myself 2 days a week to do something I want. The other 5 days can be dedicated to nursing school, truly. And that's something you really have to do for your mental health. And on those 5 days, you go hard. You study. You get a partner. You study for your tests. You go over things. You do your work. But those 2 days are just for me. And truly, you have to tell yourself those things. So I feel like with my students, that's something that they have been going through, that I've seen. They just, that disconnect between reality and nursing school, and it's kind of hard to bounce back from like life happening, you know. So that's what I would say.
Yeah, and that's difficult too sometimes when you are experiencing things for the first time, like you kind of mentioned before, like if someone loses a parent or a loved one or something like that's, you know, going to be hard, and it's going to affect every part of their life, especially when you're in a degree program like this where it takes up a good chunk of your life.
Yes.
So yeah, that can be a tough adjustment.
Oh my gosh. But I always encourage people to, like, one, if you have any questions, obviously reach out to somebody. It might not be a professor you currently have, but reach out to somebody. You know, there's so many resources that I've learned myself about Augusta University, and like the resources that they have and the nursing school, how they have. So just reach out to somebody.
What skills would you say are like essential that someone should have going into being a nurse, like the actual practice?
Ooh, to be honest, with me, myself, I had no medical knowledge coming into nursing school. Like, absolutely none. All I knew was math and science. You know what I'm saying? And I sometimes wish that they required a medical, what is that? Like a medical terminology class before nursing school. I wish it was a requirement, because I had no idea what cardiology was. I didn't know what oncology was. You know what I'm saying? So like, or a 24 gauge IV, had no idea. So going into it, I was very like, whew, okay. So I feel like one of the skills that I don't even know if this is a skill or not, but like truly be open-minded and listen. But another thing would be I think you have to have really good time management skills. And I think that is in nursing school as well as when you become a nurse, because that is going to be essential. Time management with your work, with your workload, your actual job, school, and life, having friends, having family, balancing those. Time management as a nurse, you're giving medicines, you have multiple patients a day. Spending this amount of time with this person's a little bit more acute right now, so I may need a little bit more time here, but how can I give them this time and also give my 3, 4, 5 other patients the same amount of time, the same amount of quality time, to make sure that they're okay. So time management is a big deal, and I try my best to teach my students that as well, especially when they're on the floor in real life. Definitely try to make sure like time management is something that you learn first, or in the beginning.
So at Augusta University, you know, our university's tagline is that is an experience like no other.
Yes.
And so I'm curious, with your experiences as a student, faculty, and alum, how has Augusta University been like no other to you?
Oh, that's a great question. Wow. I feel like Augusta University has been in every aspect of my career. Like we're talking about, like me coming to school here, me working here, me becoming a professor here, and even I didn't even realize I wanted to be a professor until I began like precepting and all that. But just the fact that I was afforded the opportunity to do that. So I feel like the experiences I've had have been life-changing. Really, the fact that I've been awarded opportunities that I I don't necessarily know I would get anywhere else, where the school is affiliated with the hospital that is affiliated with the nursing school. And I got to experience all those aspects. So I feel like as an entity of Augusta University, it has created a life-changing experience that I don't think I would have been awarded anywhere else. So I really am grateful for the college and for the hospital for awarding me those opportunities so I can blossom into the practitioner that I want to be. So truly has been in every aspect of my career, and I'm truly grateful.
Well, I'm grateful for you taking the time to chat with me. I know you're very busy right now, so I truly, truly appreciate it. And I can't wait to call you Dr. Thomas very soon.
Thanks. Oh my gosh, it's nerve-wracking. But I appreciate you having me. This is so, gosh, I love it so much. I was so happy when you asked. Very grateful again.
Yes. Hey, you guys, I hope you enjoyed that episode. I really enjoyed talking to both of those ladies. It was just, I always get inspired when I hear people that just have great stories, especially those that are alumni like me. And just the nursing field is so cool. It's changing just as we continue to grow in 2024. So I hope you enjoyed that episode. If you really liked it, don't forget to like, subscribe, do all those things, share the episode with your friends. And if you are a nursing student here, congratulations. And I cannot wait to see all the cool things that you do. And until then, I'll see you guys in the next one. Go Jags!